I'm Dr. Davis Clark, and presently I failed retirement as a surgeon, but I am still working in the office seeing spine patients. I came here in 1972 and started a practice which is what you're looking at right now. We now have, 26 doctors and another 10 or 11 nurse practitioners and physician's assistants. All based on the model of being a subspecialty practice, which has worked very well for Concord Orthopaedics and for the Concord Hospital and for New Hampshire. Somewhere in high school, that's what I really wanted to do, and I was told initially that it was too expensive to go to medical school, and so I was told I really couldn't do that, but somewhere along the line in the middle of college, I decided I had to do that. There was no other way. I went to undergraduate school at the University of Rochester, and after 4 years as a naval officer, I returned to medical school there. And following that, I did 5 years of residency training program in orthopedic surgery. I think that the last 45 years or so for me has been a very exciting time. When I first came here to practice, total hip replacements had just come on the horizon. And in fact, I was fortunate enough to do one a couple of months after I got here, which I understand was the first one done in New Hampshire. And a few years later, we started doing total knee replacements, and then total shoulders and total wrists and total ankles. The patient has to have complete trust in what you're advising them to do. And patients are pretty smart. They have a good sense of whether what you're recommending for them and what have you, whether it's on target or it isn't on target. You've just got to take the time to sit and listen to them. I had a faculty position in Rochester, New York at the University Medical Center, and for a number of reasons, I started to think about going into private practice as opposed to staying there. And one of the residents from Rochester came out here and looked at the urology job here in town, and came back and couldn't stop raving about how wonderful Concord, New Hampshire was, and how many young, very well-trained physicians were coming from Boston and New York hospitals. And so I came up and took a look in April, and I was here to start the practice in July. I really fell in love with the place. I think when I first started the practice, there were two ways to look at orthopedic practice. One was everybody does everything. And sure, when I first got here, I was by myself and I did everything. But I developed the practice along subspecialty lines, and now it is pretty evident we have total joint surgeons, we have hand surgeons, we have foot surgeons, we have spine surgeons, and that just makes these people better because their practice is limited and honed down on a specific area. That doesn't mean that they don't know things about the other parts of the practice, but they are able to provide better care for our patients, and that's why we're seeing patients from all over the state, and a few from Vermont and Maine too. I had been here about 6 weeks, and I was so snowed under with a waiting list that I hardly knew what I was going to do next. And of course, in those days, we didn't have emergency room physicians. And like as not, you'd get called at 2 o'clock in the morning by the nurse in the emergency room who would say that somebody's here with a backache and you've got to come in and see them. And nowadays, all of that is, obviously is changed and modernized, and it's been all for the better. Just long as the physician's taking care of the patients, remember that it's a privilege to take care of the patients, and you don't want to lose sight of that.